So I have had a few clients now ask me about alcohol and basically saying that alcohol seems to calm things down a little bit. It seems to have a pain relieving effect. Now, I know this isn't true for everybody, but for some people, alcohol can help calm things down and reduce pain. And so I've had a few clients who come and now have asked me about why does that work? Why does that happen? They're asking more from a curiosity standpoint. They're wondering why, from a neurologic standpoint, from a nervous system standpoint, what is actually happening there, purely to understand because they have a curiosity. They're not asking because they're necessarily worried about addiction. They're not asking, because they are struggling with drinking too much and it becoming a problem. They're asking because they're just curious. They've noticed this relationship. And so I figured I would explain things because I'm sure that more people have the same question, are wondering the same thing. So that being said, this is not a lecture on why you shouldn't drink alcohol. This is not a lecture on why alcohol is bad for you. This is not to shame you if you drink alcohol. This is not, me shaming you into signing up for AA. It's not that, okay? This is simply a discussion to explain some of the neuroscience of alcohol and pain. I'm not against alcohol. I'm not anti-alcohol, nor am I saying that you should just drink your pain away. This is not a discussion on addiction. I am very sensitive to those topics, and understanding that that is a very difficult situation to be in. And in no way is this me encouraging anyone to use alcohol for pain relief. Okay. But like I said, this is just a discussion for those who are curious to understand some of the neuroscience of pain and alcohol. So, that being said, let's get into it. The first thing that you need to understand in this conversation is how pain is modulated in our pain system. Okay. So, there is a mechanism in our pain system called descending inhibition. Basically, descending means from brain down, inhibition means blocking pain signals. Now, all of the pain science researchers don't come at me for calling it that, but basically, that is an oversimplification, an oversimplified way of describing descending inhibition. Basically, what happens is the brain will use neurotransmitters, inhibitory neurotransmitters, to basically block or inhibit danger messages from coming up. So basically, danger messages can be coming up the spinal cord, and the brain can decide to block those danger messages. It uses inhibitory neurotransmitters to do that. It will use endogenous occurring opioids. So your own body creates its own opioids. It will use opioids to block pain messages. It will use serotonin. It will use endorphins. Things like that will block those messages from coming up. We call it descending inhibition. Essentially, pain inhibits pain. That's the mechanism that happens. And it is a natural occurring mechanism. We do know that in people with chronic pain, for some people, that descending inhibition mechanism is limited. It becomes impaired. So the body's natural pain blocking mechanism becomes impaired in people with chronic pain. That's one of those neurologic adaptations that happens. So when we introduce alcohol, basically, alcohol enhances descending inhibition. Basically, it enhances those happy chemicals that block those danger messages. And so, thus, the pain feels blunted as a result. And like I said earlier, some people, not everybody experiences a reduction in pain when they drink alcohol. So, for some people who do, it could be that they're one of those people that has a limited ability to access that pain blocking pain mechanism, right? Their descending inhibition is limited. And so when you drink alcohol, it basically enhances descending inhibition. So that could be one reason. Now there's a few other ways that alcohol can affect pain. And first we need to understand how nerves work in order to understand how this happens and how alcohol can limit pain. So just want to show you this diagram here, hopefully to try to explain how nerves work a little bit. So basically, all nerves work via fluctuations in electrical activity. So all of our nerves have some level of electrical activity going on inside of them at all times. Nerves are kind of humming along at baseline. There's always some fluctuating level of electrical activity inside of a nerve at any given time. And it's constantly going up and down. It's humming along based on what is stimulating that nerve. Now, all nerves have a threshold level of electrical activity. And in order for that nerve to fire and send its message and transmit its neurotransmitters, the electrical activity in that nerve has to reach that threshold level. It's an all or nothing sort of thing. So if the electrical activity sort of approaches that threshold but does not reach that threshold, nothing happens. So the nerve has to be stimulated enough to reach that threshold. This is kind of what that looks like. So the nerve can be humming along at rest. Something significant happens, stimulates that nerve enough, it reaches threshold, it fires and sends its danger message. Then it kind of goes back to baseline and keeps humming along. Now, what happens sometimes, another neurologic adaptation that can happen, the nerves can basically become more excitable. And normally, say any given nerve might be humming along down here, where the baseline is down here. But when a nerve becomes more excitable, more sensitive, its resting level of electrical activity is higher up. So it's humming along now much closer to that threshold. So it doesn't take much of a stimulus to get that nerve to reach the threshold and thus fire and send a danger message, right? So normally when that nerve is at rest, it's down here. Normally that nerve, it would take a pretty big stimulus to get this nerve to fire, right? So I might have to bump my knee on the table pretty hard in order for that nerve to fire and send its danger message. But once that nerve becomes sensitive and its baseline level of electrical activity is much higher, it's up here, now it doesn't take as much of a stimulus to get this nerve to fire because it's more excitable. So now this nerve might be able to just pick up on a small change in temperature or a small change in inflammation or something like that. And that gets that nerve to fire, or a small stretch or a little bit of pressure or even a light touch, right? Could be enough to get that nerve to fire. It goes above, it's stimulated above the threshold and it causes that nerve to fire, which means more pain. Now, when nerves become excitable, this is a pretty common occurrence for people with chronic pain. We know that their baseline level of electrical activity is already higher. It's much closer to the threshold. So their nerves are more excitable, the nerves are more sensitive. Stay with me because there are chemicals that it can excite nerves and basically raise this baseline level of electrical activity. And there are inhibitory chemicals, chemicals that lower the excitability of the nerve and basically bring that baseline down. So basically, what you need to know is that glutamate and NDMA, they are excitatory. Basically, glutamate and NDMA increase electrical activity, make the nerves more excitable, thus more pain, right? And then there's GABA, and GABA is inhibitory, okay? Which basically means it lowers the electrical activity in the nerve, meaning essentially less pain. It's less excitable, okay? So again, glutamate and NDMA excites nerves, GABA inhibits them. The excitability, like the baseline level of electrical activity inside the nerves, this is like the volume, right? So that volume, the baseline can go up or down. And these guys over here are like the volume dial, basically. The glutamate increases the excitability, GABA reduces it. Now, hopefully you're following along. We're going to talk more about alcohol in just a minute, but I know what you might be thinking. You heard me say GABA, right? Which makes you probably think of gabapentin. And maybe you're thinking, okay, gabapentin, this must be how gabapentin works. Gabapentin must basically act like the neurotransmitter GABA and bind to GABA receptors and thus inhibit excitability, inhibit our nerves and lower the excitability in our nerves. And yes, it does that, but it actually does not have anything to do with GABA and the neurotransmitter GABA or GABA receptors. So the drug itself, despite its name, it does not actually bind to GABA receptors, nor does it increase the release of the GABA neurotransmitter. But structurally, gabapentin is very similar to GABA, the neurotransmitter. And early on, it was actually thought that gabapentin acted on GABA receptors, hence the name, but they actually have found that it doesn't actually directly activate or mimic the GABA neurotransmitter. Okay, so gabapentin actually binds to calcium channel subunits, which they actually do inhibit the excitability of nerves. They lower this baseline, this excitability level down, but they actually work by inhibiting the release of excitatory neurotransmitters like glutamate. So gabapentin actually works a little bit differently. It doesn't actually work by this mechanism. It actually inhibits glutamate and NMDA receptors. So it does actually lead to less excitability, in case you were wondering. But back to alcohol. So what does alcohol do? So alcohol actually increases the strength of the GABA receptors, essentially. So GABA is the neurotransmitter that inhibits excitability, inhibits nerve activity. It lowers the electrical activity in our nerves. So when we drink alcohol, it increases the strength of those GABA receptors. And so that means that it will bring down that baseline electrical activity in the nerve, making it harder for that nerve to fire. It takes a greater stimulus for that nerve to reach the threshold, right? So alcohol dampens excitability. Additionally, alcohol inhibits the NMDA receptor. So again, NMDA is an excitatory receptor. Glutamate is the excitatory neurotransmitter that binds to NMDA, but basically, alcohol inhibits NMDA receptors. So again, if this excitatory receptor is inhibited, it's going to lower the electrical activity in the nerve, making it less excitable, less sensitive, further away from that threshold, lowering the electrical activity. So a larger stimulus is required for that nerve to fire. So you could say, in a way, alcohol has a very similar effect to gabapentin on our nerves in this aspect. And so all of that will result in decreased anxiety. It can result in relaxation, sedation, and decreased pain because of this, right? So that's kind of what happens in the short term, immediately when you've just consumed alcohol. Once the alcohol leaves your system, there's something that happens that is called rebound hyperalgesia. Basically, after the alcohol leaves your system, your nerves go back up. We experience an increase in sensitivity. And typically it's a mechanical sensitivity, a thermal sensitivity, so it's sensitivity to temperature will spike after the alcohol leaves the system. That may not be for long term, but it's this rebound effect. It kind of bounces back up, essentially. Now, when there is a repeated use of alcohol, what ends up happening is that glutamate can become upregulated. Essentially, there's more of this excitatory neurotransmitter present. It's upregulated. So again, the sensitivity of those nerves goes up. That's with repeated use of alcohol. Additionally, repeated use of alcohol will cause GABA, the inhibitory neurotransmitter, to be dysregulated. So again, that means more excitability of the nerves. Additionally, outside of this mechanism, repeated use of alcohol will disrupt the stress axis, what we call the HPA axis, the hypothalamic pituitary adrenal axis. Basically, what happens is when we drink alcohol, immediately, like in the short term, it raises our cortisol levels in the moment, which can produce this stress relieving effect and almost an energizing effect in the moment. But long term, that causes a blunted cortisol response, thus resulting in low cortisol levels overall, basically a flattened cortisol rhythm, which thus will disrupt the anti-inflammatory balance that is needed in our bodies. We do need a normal cortisol rhythm throughout our days, but if that's flattened due to long-term alcohol use, it can lead to more inflammation and cause more of these neuroadaptive changes to occur, what we call central sensitization. Additionally, that HPA axis is linked with descending inhibition, which we talked about at the very beginning. Descending inhibition is that mechanism where pain inhibits pain. Like the brain inhibits the ability for our bodies to send these danger messages. And so when that HPA axis is disrupted and the cortisol rhythm is not normal, it affects the ability of your body's natural pain blocking mechanism. So I know that this was a bit neuroscience-y. I know that I used a lot of terms that may or may not make sense right now, but hopefully this was helpful in understanding how alcohol influences pain. In summary, basically, alcohol will limit our ability to block pain. Our body's naturally occurring pain blocking mechanism is enhanced momentarily during while alcohol is present in the body. And second, it will increase the strength of GABA receptors, thus dampening excitability, and inhibits the NMDA receptors, which again, NMDA is excitatory, so it inhibits the excitability of our nerves. So in the short term, alcohol essentially lowers the excitability of our nerves, right? It lowers the baseline level of electrical activity so that our nerves are just not as excitable. It's harder for those nerves to fire under the influence of alcohol. However, long term, it can actually do quite the opposite and raise everything up. So hopefully that makes sense. Hopefully that gives you a deeper understanding of a few of these neurologic adaptations that happen in cases of chronic pain, and also how alcohol influences pain, how it has an immediate effect that can dampen pain and stress, but also how it can lead to more of these neurologic adaptations and thus lead to central sensitization in the long term. But anyway, that's it for now. I hope this was helpful, and I'll see you next time.